Good morning, everyone. So I'm here to present today on one of the research projects that was funded by the Psych Café that I got to present at the Society for Personality Assessment Convention and the American Psych Association conference earlier this year. And this presentation is called Integrating Multicultural Competencies and Social Justice into Assessment, using this tool called the Wright-Constantine structured cultural interview. So I think the best way to follow these presentations, since I mean this really is a study about how we can incorporate multicultural competencies in assessment practices, right, using this tool, and it would make sense for you to know or be acquainted with what this tool is about, so that the rest of the presentation makes sense. So I'd say that, you can go to this website or scan the QR code. So I'm just going to pause for maybe 20 seconds for you to just load this up on your phones. All right. And so I'm going to talk a little bit about this tool and show you what it looks like on my screen before I go into what our study found, right? So this is basically a structured clinical interview. I think the way I like to think about it is that, if many of you may be aspiring clinicians, right? And you're meeting a client for the first time and you're trying to get like an intake, right? You're getting information about them, their background, why are they here? And a lot of times in our existing assessment tools or therapy tools, there isn't a structured way or comprehensive way for us to collect cultural information and incorporate that in our conceptualization. And so this tool was developed by two professors at NYU, and they decided to look at, based on the addressing framework, what are some aspects of identity that are important, right, and relevant for our clients, and how can we ask them about how these different aspects of their identity has affected their worldview, and let them talk about it however they want. So I think by virtue of being NYU, many of your courses would have covered the addressing framework. So I don't think I need to go into this in detail. And let me pull out the interview. The interview kind of looks like this, right? Let's see if I can make it a little larger, right? So it's an interview that any of you can sort of go and incorporate in your own intakes or even in therapy, right? Just pulling out as necessary what questions may be relevant for the client, right? So for example, let's say across different aspects of identity like age, right? There's some guiding questions like what can you ask your client, right? Maybe you can ask, thinking about a time period where you grew up, how does that affect who you are and how you live now? And if this seems like a particularly relevant question for your client and the client has a lot to share about it, you can go on to ask some follow-up questions along this side, right? So you have that for age, gender identity, and so on and so forth. So it's not that's necessarily in the order of addressing like A, D, D, R, E, S, S, I, N, G, but it's ordered as such because it flows a little better, but it's up to your own discretion how you want to ask your questions, right? So yeah, so let me go into this, right? Oh, how does this work? Just pause. Pause. Okay, so I managed to figure this heck thing out. So as I was saying, can use the whiskey either as part of an intake, right? When you first meet the client, can meet them, when it can be used, for training purposes. So, sometimes in your courses, so far your professors might have asked you, to elaborate on how you identify in the addressing framework, how has certain aspects of your identity affected your worldview. So you could really use it for this tool for either purpose, right? For introspection or for getting information from your clients. So, okay. So today I'm going to be presenting about, well, when among the clinicians who have used this tool, what do they think about this tool, right? What is the feedback that they have? Do they feel like it's useful when they are collecting information from their clients? And is it useful as a tool for them to develop their own multicultural counseling competencies, right? So let's go. All right. So, what is well, when we think about why this tool was created, well, it first of all created with the intention of understanding client experiences. So whenever we try and ask our clients about, their presenting problem, their symptoms, it's really important for us to contextualize it vis-a-vis the background and their experiences that they come from, right? So for example, if a client presents as hypervigilant, but let's say this client's from a minority group where there's been a history of oppression and systemic sort of racism, then maybe the hypervigilance is almost normal. It almost makes sense as to why that hypervigilance is there, right? Supposed to a client from a different background, all right? So the whiskey also allows our clients to express their different identities, especially when they're intersecting, how it uniquely has shaped their worldview. It's allows us to incorporate social justice into assessment by whereas we understand the client better, we're better able to advocate for them. It's also helpful for it to be a part of an intake and helps clients and clinicians to explore their own identities and how that plays out in therapy or in assessment, right? So really our research question is, well, does the whiskey deliver across, these initial purpose? So specifically, how do trainee clinicians experience use of the whiskey? What is the impact of the whiskey on their multicultural and social justice competencies? But this is a qualitative study, and we interviewed 14 doctoral students across a few universities. And these are doctoral students who've had experience using the whiskey as part of their training. They've been trained in it by their professors, and they have used it with their clients. This is the demographic breakdown. And what did we ask them, right? So let's see. So we asked them, well, what is your experience with multiculturalism and intersectionality, right? And especially in your training program, let's say, has your past experience affected your selection of programs to enroll in, right? What is your experience with conducting cultural interviews? Is with the whiskey the first cultural interview that you've ever been acquainted with? Let's see. Right? And let's see. We also asked them about their experiences with the whiskey. So, do you like it? Did you not like it? What did you like about it? What did you find challenging about administering it? How did you administer it, right? Do you use it in an intake or in therapy? Do you do it all at one go? Right? So one of the frameworks that we looked at to make sense of our findings, theoretical frameworks, the multicultural and social justice counseling competencies. And this was a framework that was developed by Daryl Su. And it basically says that, the way the way the client well, so first there is how the client thinks of their identities, right? And there is how the counselor thinks of we think of our identities, right? So there's the client worldview, and then there's the the self-awareness, right? And when we as counselors or clinicians are aware of our own identities and how they may affect our conceptualization, our interaction with the client, the therapeutic relationship, right? We are better able to understand their worldview. We are able to understand how that's affecting our dynamic, and that consequently allows us to be in a better position to engage in social justice interventions, right? And what are multicultural counseling competencies, right? You can sort of break them down into um, 4 components, right? One being attitudes and beliefs, and that maybe as well, what do we are we constantly reflecting on what we know and what we don't know, right? The idea of cultural humility, right? And then there's knowledge. Knowledge would be like concrete semantic knowledge about someone else's culture, maybe, right? And skills. So I may know the about other people's cultures, but I may not have the skills to know how to talk to them about it, right? Or know how to get the information, right? And then all of these, when we have, both we have a lot of knowledge and we have developed good clinical skills and we have the attitude of constantly reflecting of our own positionality, all of it can then translate to effective action. So the interview protocol. So we also asked clinicians, well, among the as a training tool, right? So not just in collecting information from the clients, but in terms of your own training, does the whiskey help you to develop these multicultural competencies? So in the form of self-awareness, that's where your attitudes and beliefs are in, right? Self-reflection and learning, does it help you to understand the client's worldview better? That's the skills, right? In engaging with the client and eliciting information about that, right? Does it help you to develop therapeutic rapport? That's counseling relationships. And does it affect the interventions that you eventually decide to engage in with the client and how you deliver them, right? So findings of our study. Well, first we found that most of our trainees received some form of multiculturalism training prior to graduate school, and this came from prior research experiences, self-studies, some lived experiences, prior degrees, just there's a fairly wide range of training experiences in this field that they had obtained, right? However, they gave the feedback that most of their training was breadth over depth, maybe just a bit of everything, not enough depth, not enough detail. And they felt like they had overwhelmingly positive experiences with the whiskey. They felt like it was a useful tool for them as they used it to engage the clients. One of the strengths that they cited was that it was structured, and by virtue of being structured, there was a framework that they could go off of. It reduces the cognitive bandwidth that you need to think about, how do I ask this question to the client? Or what aspects of identity have I not asked? Like it's very nice to go back to a tool which is structured and comprehensive, and you can just refer to it, right? So you don't have to expend extra energy thinking about the right way to ask something, right? And on top of that, there was a flexibility with this tool, right? Because with every aspect of identity, you can let the client talk however much or however little you want. As a clinician, you can also decide to go more in depth on some parts or not, through the follow-up questions or otherwise, right? And interestingly, trainees reflected that this tool was helpful for those with both, not just those with marginalized identities, but also those with privileged identities. And this was really interesting, right? Because sometimes we think, well, for clients who hold privileged identities, maybe is it that their presenting symptoms are not as quote unquote relevant, right? Identity may not be quote unquote as relevant compared to those with marginalized identities. And we find that with the whiskey, sometimes it actually gives even folks with privileged identities a an avenue for them to talk about it, right? And in this regard, then you acknowledge that, culture impacts everyone, right? Regardless of whether you hold privileged or marginalized identities. There was also no pushback from clients. It was easy to administer. I know sometimes we think, well, if clients don't proactively talk about, culture-related symptoms off the bat, does it feel jarring to ask them about culture? Would they think it is not relevant? Of that, but the clinicians gave the feedback that clients actually really welcomed these questions. Some of them even said that they've never been asked these questions before and they really appreciated reflecting and thinking about it, right? So no pushback from clients, and that this was a tool that was easy to administer, and that they often administered it in one sitting. So maybe, in an intake, they would take one 45 minutes maybe, go through the whole interview. Maybe they would get a piece in small pieces here and selectively, right? But they will administer it at one go. And you get a lot of very open-ended, the rich content because of the flexible, open-ended structure of the interview. So some of the critiques that they had about the whiskey is that using this in other languages can be clunky, right? Can be a struggle to capture the full nuances, right? Because some areas are naturally more complex, and that makes sense, right? No tool is entirely comprehensive, and I think with every tool there is a trade-off between how concise you want it to be, right? Given time constraints, and how comprehensive do you want this to be. Also, given that this tool was developed in an American setting, the English language, it makes perfect sense that translation into other languages can be a little clunkier than administering it in English. So that's right. Oh, and it is useful for developing rapport. And so in some clinics, the intake clinician is not always the same clinician that's delivering therapy. And so for some clinicians, after they use this tool and they've learned so much about the client and they've developed really good rapport, it can be hard for this client to eventually be transferred to another clinician, right? Because it's just difficult saying goodbye. So they found that clinicians gave the feedback that the whiskey was most helpful. Oh, it's a tool on, I've just, all right, we are back. Sorry, many tech difficulties today. So as I was saying, clinicians reflected that the whiskey was most helpful as a tool, right? And as with any tool, you can't, if you don't carry the right attitude, the tool is as good as your attitude is, right? And so it doesn't preclude you from engaging using this tool with an attitude of curiosity, right? Using a clinical judgment along the way. You can imagine that if you ask the questions in the whiskey with a tone of disinterest, the client's not going to respond well, right? There's certainly some judgment involved in deciding what do you follow up on certain themes, how do you incorporate the content that you obtain into the conceptualization, right? It gives you space to ask additional questions and follow up if you want to. Okay, clinicians also gave the feedback that this positively affected their relationship with the clients, right? Because oftentimes it might be the client's first time reflecting about culture. And when they are explicitly asked, how did this aspect of your identity affect your worldview, it gives them permission to reflect upon it, right? And as they share about the answers to these questions, that process in and of itself can be therapeutic because they are being affirmed, right, for their experiences with the therapists on the opposite side, giving their unconditional positive regard. Naturally, it helps the therapeutic alliance and the rapport, the relationship. Right, and I was saying earlier, oftentimes there is not a lot of resistance to questions. They're often welcome. So here's an example of a quote from one of our participants, right? being able to ask those questions from the whiskey, I think, opened the conversation that we needed to have, that he needed to have about his identity. His concern was his identity, was his anxiety, and then it turned into this whole thing about identity. And so I thought it was incredibly important that the whiskey was used, and that also like informed a lot of the care that we did and conversations that we had about himself. And I think he, it was his first time doing therapy. I think he felt very comfortable with me, and I'm sure the whiskey has something to do with that. And he had like a comfortable conversation, I believe, talking to me about these things. And I think the whiskey was important in that as well. And so you can sort of see how, in this example, this clinician, the whiskey was helpful in building the therapeutic rapport. Right. So another quote, right? I've learned things about the clients that it's not to say I couldn't have thought of those questions, but the fact that it was structured that way, I feel like I wasn't going to miss anything. It wasn't going to be up to me to remember to ask certain types of follow-up from. I guess I feel like it's been really helpful for building rapport. They said a couple of times, oh, I never actually thought about that. And I think people generally like it. People typically talk a lot. And in my last case, the information was the backbone of the entire conceptualization. It's hard for me to imagine how I would conceptualize what this person is going through without the whiskey if I hadn't asked all those questions in detail. It just gave me so much important information. So I think in this quote, you see that, the whiskey, by virtue of being structured, relieves the clinician of the burden to be comprehensive, also builds rapport and helps this clinician with their conceptualization. So trainees also gave the feedback this was helpful in their conceptualization and contextualization of the client's presenting symptoms, right? And help them to understand their client's worldview, impact of intersecting identities, resulting in a more holistic conceptualization, contextualizing some of their presenting symptoms, right? Allows them to explore some of the nuances within their identities, right? So here is an example of a quote. I'm thinking of like my non-binary clients I had. So I feel like I got a glimpse into their worldview, like how they navigate things, what feels unsafe to them, the value of being in queer spaces though. I feel like I can relate to that with like, I like being in queer space, in Black spaces, where I don't have to code switch or like think about if people are understanding what's happening. Like you can be with that shared experience. So what I find interesting about this quote is that, the clinician is not only understanding their client's worldview using with the help of the whiskey, but they're also relating it to their own identity as well, right? And the shared experiences that they may have, right? The shared feeling, right? Even if the actual encounters are different. So what about how the whiskey can help clinicians develop their multicultural counseling competencies, right? First of all, in terms of the skills, right? Trainees gave the feedback that using this tool gave them the confidence to talk about culture and how it impacts their presenting problem or therapeutic process, right? When you get practice in asking these questions multiple times, you start to learn, well, this may be a good way to ask the clients these questions in a neutral, non-judgmental manner, feel more confident engaging in such conversations with them and knowing that it would be well received, right? It also helped to improve these trainees' self-awareness because it helped them to think more about their identities, learning about how cultural factors can impact themselves and their clients and their interactions and their multicultural competencies. So here is an example of such a quote. I would say that there's a lot of reflection before and after the whiskey session where I administer it, just thinking about what did I expect? What surprised me? Why did it surprise me? What does that show me about myself that I was surprised? What does it show me about myself that I probably wouldn't have thought to even ask these questions? What biases did I have with certain people, or just like what general gaps in my understanding is there? I think it can point me towards areas I need to get educated, get more training so that I can better work with clients. Right? I think that's it. So let's just stop sharing. We're not doing this study. And yeah, thank you so much for listening to the presentation. Stop.